Welcome back to the Data Doesn't Equal Outcomes podcast, where your host, Tristan Keelan, and his guests explore everything about data, from culture to metrics to telling quality improvement stories for the human side of analytics. Hello, everybody. Welcome to another episode of the Data Doesn't Equal Outcomes podcast, where we discuss all things data and how to turn data into action and positive change. My guests today are Christa Foschio-Bebak, the Director of Quality Improvement here at CCNY. Christa, thanks for joining us.
Thanks for having me.
And my second guest is Catie Gavin, the First Deputy Commissioner at Erie County Department of Social Services. Catie, it's such a pleasure to have you on with us today.
Yeah, thanks for having me.
Okay, today's topic specific to Erie County is about data coaching and how that drives the preventive wraparound services here in Erie County. So Christa, maybe you could kick us off with a little introduction to the High Fidelity Wraparound model and help us understand how that's been incorporated into Erie County service delivery.
Great. Yeah, for sure. So High Fidelity Wraparound has been around now in Erie County for about 20 years. It started off through a SAMHSA grant through Erie County Department of Mental Health. And in that instance, the model specifically served SED youth, so severely emotionally disturbed youth. And it was predominantly a voluntary service where families would be referred either by community organizations or could make self-referrals to enter the program. Because the model High Fidelity Wraparound has been so successful in Erie County, it has now since evolved to not only serving SED youth through Erie County Department of Mental Health, but even now, more importantly, serving child welfare families through Department of Social Services. And I say more importantly because High Fidelity Wraparound is a nationally evidence-based practice. So it's recognized nationally as a program or as a model that delivers great outcomes when done with fidelity. So over the past 5 years, DSS has been using this model to service their preventive service programs and the families who come in through that door. So they now have a direct link and referral source to the care coordination agencies that provide high fidelity wraparound.
Excellent. Thank you for that that overview. So nationally recognized evidence-based practice. Catie, you're with the county looking at service delivery models. Why did you choose High Fidelity for Erie County?
Well, High Fidelity, so as Christa said, it has been in the county for several years, so we were familiar with some of the practice and some of the successes that had been seen on the mental health side, but it also encourages family engagement from the front end. It builds families' capacity to build their own natural supports, to look at community supports, and it helps families to kind of drive some of the decision making so that there's more buy-in for what their needs or how they want to get to the outcomes that need to occur in the family. It also is a little different than some of our traditional case management preventive service programs because in addition to the case management, there's also vendor services so that a family kind of has some choice about what some of their needs are and how they want to get those met. So either in-home therapy, skill building, there's an array of services to kind of choose from to bring into your home. And it encourages families to take a more active role in designing how they're going to reach those goals.
Excellent. So not a simple model, right? It's not a one provider in front of one client, which is, much easier sort of operationally to understand. You've got vendors, all these different supports. You're working with all the members of the family, not just, siloed into specific individuals. So that creates a complex tracking and data mechanism when you try to look at it from that standpoint. So you use a dashboard to track some of the key metrics. I was wondering if you could explain a little bit about what metrics you're monitoring regularly and sort of how you're interpreting them and what your data reviews look like.
Sure. So So the dashboard is great because it sort of organizes some of the key things that we are always looking for in service provision for families. It looks at things like length of stay, caseloads for the workers. It looks at critical incidents, and then we've grouped the critical incidents into kind of three buckets, so to speak. And those three things are the main tenets of child welfare practice and kind of what we're always looking for in child welfare. And that's for families to be able to be safe, for children to find permanency, and for families to have well-being within the community. So when we look at everything kind of from those three main tenets, we've grouped the critical incidents into those buckets so that we're sort of monitoring to make sure that we are improving safety outcomes, that we're improving permanency outcomes for children, and that families are well within our community. So it kind of helps us to keep that language and those three important tenets in the forefront of how we're thinking about the work on a daily basis. We also look at things like we use the North Carolina Family Assessment Model, the NCFAS, to monitor where families were when they started. There's a baseline and then kind of where they are throughout the life of the case. So we're looking for specific improvements in that assessment throughout the life of the case. And then we're looking just sort of to monitor like how quickly we're seeing families face to face, how quickly we're getting that first child and family team meeting together, to really drive home our goals of early family engagement and family driven practice.
How often are you sort of in the data, taking a look, and what's the county's thought process in terms of monitoring the data?
Mhm. So, I mean, we look at the data minimally quarterly, but we look at it probably more often anytime there's an issue coming up or questions about, what the caseloads look like or what the length of stays look like for any reporting, things like that. But for the most part, where we use it most critically is in coaching sessions with our contract providers every quarter when we talk about kind of where their agency is, where, what their strengths are, where there might be some opportunities for improvement, or just asking some critical questions to better understand why we're seeing what we're seeing.
And so, Krista, that's where you and your team come in, supervising with data coaching. And I think, in terms of operationalizing data, behavioral health, child welfare, I think it's becoming more and more accepted. But once you have the data, it's the entire theme of this podcast, you have to do something with it, or it's just ones and zeros sitting in a database. So, can you introduce us to supervision with data, and maybe tell us a story or two about how you've been able to pinpoint specific coaching with the data, and what improvements you saw?
Yeah. So Katie alluded to sort of our framework or overall collaborative framework around how Erie County uses our data. So initially, obviously, we are there on a quarterly basis with Katie and her DSS team to review the quarterly reports through the dashboard. But then we also supplement those quarterly review meetings with monthly and or weekly coaching with specific supervisors using the PI report. So the PI report is something that CCNY developed. It stands for Predict, Improve, and Enhance. We use that report as a supervision tool that supervisors can access real time any day to gather their data for both open current cases as well as discharge cases. And I should say that that PI report was in fact developed with supervisors. So I bring that up because it is, to your point, not just rows and rows of data.
Mhm.
Rather, it's a visual tool with supervisor input to create buy-in and how they wanted to view the data. What would be helpful to them to incorporate into their supervision practice? So it really is not only a unique tool in that it can be accessed every day with real-time data, but it's also was developed through the lens of a supervisor so that everything they needed to supervise with one individual staff or through their staff meetings could be accessible and something that was meaningful to them that they could understand. So once we had their buy-in, meaning they sort of looked at the data and said, can we look at it in this manner, meaning through this sort of graph, or can we look at individual rows of data if we need to drill down and dive deeper? Once we had their buy-in in terms of how they wanted to look and how they wanted to use it, and then we could supplement that with our coaching. And so the supervisors, I would say locally, have been fantastic in terms of engaging with us and wanting us to be there to help them sort of sort through the data and then help them identify where there were or are areas for improvement. So I can give you a couple of examples. Through our PI report, we not only monitor fidelity wraparound outcomes, but we also monitor important process metrics. And we know that sometimes those outcomes, those more substantive, meaningful outcomes, can't be achieved unless you do sort of the minute process type steps. So Catie alluded to ensuring that CFTs are done on a routine basis. And for the wraparound model, it's every 30 days that a CFT is occurring. That is a process measure. And we know that in order for you to have fidelity to the model, those 30-day CFT meetings with the child and family team are critical in terms of fidelity. So when we're looking at that, we can work with the supervisors and say, hey, 65 or 75% of the time your CFTs are occurring within, 30 days. But there may be some programs or agencies that might be more at, 50 or 55%. So we work with supervisors around what are the barriers or challenges to getting those CFTs completed on time. And sometimes, it's interesting when you look at the data, it could be something as simple as, we recorded it wrong. It's a data entry issue. Our care coordinators were recording it in this field rather than in this field. So it's understanding specifically where the data is coming from in the EHR system, and that can be a quick fix. Or it could truly be that, there's one care coordinator who has a really heavy caseload, and her caseload is not heavy only in terms of capacity, the amount of slots that or amount of families she's servicing or he's servicing, but also the difficult. There could be some more intense families that need more care. And so therefore getting to the other families on a timely routine basis is more difficult. So in that instance, we're really sort of diving deep in understanding care coordinators' caseload type relative to how well or how easily it is for them to conduct those CFTs on a routine, timely basis.
Mhm.
So I'll give you another example where this is helpful for supervisors, particularly working with individual care coordinators, is that they can understand their caseload better. And then they can understand, is it just a training issue around case management and how to manage their time better? Could they benefit from working with their colleagues around what do you do differently if you have the same case type, the same amount of cases? How do you manage your caseload in terms of effectively facilitating CFTs on a timely basis? So it really allows for not only sort of a quick correction if it is just in fact a data entry issue, but if more meaningful quality improvement strategies need to be implemented, they can have that conversation based on what they're looking at through the PI report.
Yeah, I love that image of case manager is doing X with a certain percentage and another one is maybe doing better, and then just using that data to start a conversation and what can we learn from each other. And you can really only get there if you have the ability to drill down beyond the surface level, right, into those caseloads or even into those clients to find out, well, if we know these things worked, what were those things and can they be applied in other areas? It's a really great way to just use data to start a conversation or tell you which conversations you need to start.
Yeah.
Catie, I want to go back to something that you mentioned earlier about the three tenets of safety, permanency, and well-being. And one of the biggest obstacles, especially in technology, when all the EHRs came out was, we need a place for case closure. And one of the easiest ways to create that was the old thumbs up, thumbs down. Was the case successful or unsuccessful? And we found out very quickly that that's just so subjective and so hard to trust when anybody's looking at those kinds of
Mhm.
results. Can you tell us about the work that you had to do to really change the way you approach looking at case closure outcomes and how you got to those three tenets and what it means to achieve in one or all or some of those areas?
Mhm. Yeah, so we developed a custom closure form that's utilized that continues the thought process of staying with those three tenets of where it asks specific questions around what the family's safety measures currently are, how they've met those goals, and all of those things. And then around permanency, how they've met those goals. Either the children have been able to remain permanent and are now safe in the home, or in some cases, maybe, like some of the children may have gone to a placement that was necessary for mental health treatment or for kinship, and that has adjusted the family dynamics. But those are the right things to happen for that family. Normally, we used to look at where if any child was removed from that home, that it was automatically unsuccessful, but we're, being creative and flexible in how we're looking at it because that might be the right thing for that family given the circumstances at this current time. And then, the well-being indicators, the same thing, like we're looking to see that those critical incidents have dropped significantly and that the family has to some degree stabilized and are able to maintain safely in the community without our service. And then there's a conversation driver as well, that if the assessment itself comes out that it's an unsuccessful discharge, but we know that there's kind of some outlying circumstances for this family and that this outcome is actually the best outcome for them, then the care coordination supervisor from the High Fidelity Wrap Agency can contact the supervisor here at Erie County and have a conversation about, kind of how the family did meet their goals in the long run and that this is in the best interest and therefore it's a successful discharge. We want to make sure that we're being honest with ourselves when that happens. Certainly, there are cases when it's not successful, but there's opportunities to improve, and we can identify what the barriers were that were maybe out of our control that led to that happening. So it's just another way to have those critical conversations and increase the communication between the providers and the county.
Yeah, really getting away from the black and white outcome and embracing the gray area and say, let's let's be able to capture all the shades of gray in our outcomes and and discuss them and understand them. Um, that's excellent. So, Krista, talking about coaching, you talked to us a little bit about kind of the boots on the ground level of data coaching, but you also work with Catie and the whole system and look at sort of, we talked about those quarterly metrics reviews. Can you talk about any projects that you and Catie and the county have executed on a larger scale, right? That apply to the whole system all at once and kind of that plan, do, study, act methodology.
Yeah. So every year, based on the dashboard, the quarterly dashboard reviews, or based on reports, or based on evaluation reports. So we also do evaluations on High Fidelity Wraparound. So using a combination of evaluation, the analytics, the dashboard, we're able to identify system-wide improvement areas. And so every year we identify maybe 2 to 3 system-wide improvement areas, understanding that oftentimes, because it is a system-wide improvement, it's not the end game is not to identify and improve within a year. The end game is really to understand why this is or needs to be a system-wide improvement, and then work with the entire stakeholder community to create their buy-in around the system-wide improvement, and then identify strategies that can be taken at various levels. So when I talk about various levels, it's not just a system-wide driven strategy. Um, it really should and often involves a smaller micro level strategies that are co-occurring with system-wide um, problem solving tactics. So, for example, this year there was a huge push around improving and increasing our engagement with families. We know that because of COVID the past couple of years, that implementing high fidelity wraparound had the challenges because we weren't able to work with families more substantively and meaningfully face to face. And as a result, the last couple of years, our face to face engagement measures have not been as successful as we'd like them for them to be. So it was really sort of giving us an opportunity to step back and not only understand the families we're now serving, which are child welfare families, who have, just a myriad of challenges, let alone embracing a high fidelity wraparound model. And so, therefore, engaging in the high fidelity wraparound model can be more challenging in that, you're really looking at families' readiness to embrace a high fidelity wrap model, let alone some of the challenges they're experiencing um, just on their a normal functioning day. So, what we've done is worked with stakeholders across the county around what is it that we can do differently to improve our engagement efforts. And so when I talk system wide versus what agencies or even more micro level care coordinators can do differently, it really was a multifaceted approach. And so, for example, system wide strategies now include um, we're currently implementing um, an orientation type, if you will, video. And the idea is that when care coordinators or DSS workers are talking about high fidelity wraparound, they can quickly access this video that's a quick orientation for families to understand and see what the model is about. And the goal is to utilize families who've already gone through high fidelity wraparound successfully and talk about their experience while also giving them a quick um, overview of what kind of expectations that they can, what are the expectations around high fidelity wraparound and how they can work with the model to be more successful. And so the goal is rather than just sort of filling out a referral and then handing it over to the care coordinator, this gives families an opportunity to actually view someone talking about their experience that may be more engaging to a family rather than a paper referral. So that would be an example of sort of a system-wide approach. We've also done more trainings on how to effectively engage either mandated families, so families that may be mandated to do this, or engaging, youth around the process. So really now taking some of the trainings and tailoring them to fit the population we're working with in terms of engaging. So that would be another strategy that we've done system-wide is engagement training, the orientation, and then also speaking with individual care coordinator supervisors around what they can do to support engaging families and and engaging in a timely manner. So you get that referral, and rather than the referral waiting 5, 10 days before someone gets out to that person's home, what can they do to ensure that they're seeing those families within 3 days? And so supervisors have now sort of stepped up their game and saying, if my care coordinator, my staff can't do it, I'll go out there. I'll be the first touch. I'll be the warm handoff, so to speak, to introduce people to the model. And even if it's only, 10, 15 minutes, at least it's the attempt to come face to face with the family to encourage that engagement immediately.
Excellent. Very good. I think, what really resonates when I hear that is system-wide changes don't often happen within a year, and quality improvement takes patience and a realistic assessment of your time horizon. I know a lot of people are talking these days about employee retention, and it's pretty high on a lot of quality improvement lists in terms of projects. Well, anything you implement for employee retention now is going to take multiple years of an employee cycle to show you the results. And that's why it's an ongoing effort and never a quick fix. Right. So something I want to just ask you both quickly before we wrap up is about your own learning experiences. So you can define for yourselves what the beginning of your high fidelity wrap with data journey is. But start with you, Catie. If you could go back to the beginning of this journey, what do you wish you knew then that you know now?
Hmm. Um, I think I wish I knew how. I think we've made the data so much more useful for the field. And not being a technology person myself and all of those things, I think I wish I knew, you know, that it almost feels like there's just no limits. Like it just keeps, we're able to keep making it better and more relevant and using those conversations to really drive good practice, which essentially equate to stronger families in our community. So I think I wish I knew more about the technology end of it and how the data could be utilized in a user friendly format I mean, right down to like families understanding how we use that data to, drive the practice when they participate in the surveys, how we use that data with the agencies to talk about what their successes are and what the family's feedback was and why that's so important.
It reminds me of an experience I had. I was delivering a report to a program manager, and I put it up. I walked her through it. I said, is this what you were looking for?" And it was early on in our professional relationship and those roles, and she said, "No, but I am learning what I can ask for." And so some of that exposure isn't always necessarily that you're learning the technicality pieces, but on the service delivery side, you need to be able to see enough to go, oh, I can ask for things. I don't need to think about whether they are feasible. Somebody else will decide that for me. So ask for the moon and see how close you can get. Christa, same question for you going into this data journey with the county. If you could go back and give yourself that critical advice, what would it be?
Yeah, I would have to say that I think it's important to understand both the big picture and in the weeds,
Mhm.
so that the big picture and in the weeds sort of complement one another. And so if you only have a lens of big picture outcomes, then you forget about all the in the weeds details that have to occur in order to get to that outcome. And so I would say for anyone who is working with data to always have that big picture lens, but know that oftentimes in order to get to those big picture outcomes, you've got to really want to do the work and get in the weeds with your staff, your colleagues, your stakeholders, and really be invested. And I think once you have the pairing of those two things, you really do, in fact, get meaningful change. And I would say, I think that's one benefit of working with Catie and the county is that I think we both complement another in terms of, if one of us is only has one lens on, the others would sort of bring us back down and say, well, what about this X, Y, and Z? And there's a good sort of trusting, safe relationship there to ensure that we're both working together so that we can improve outcomes across the county.
Katie, anything you want to add about that relationship?
No, I would agree. We have a good working relationship. We can tell each other if something isn't working or, when it is working, how we can continue to build that up. We have to have honest working relationships with one another. And I do think it's impacting both making our workforces stronger, but the most important part is that it really is making our community stronger.
Wonderful. Well, thank you both for joining me today. I've been your host, Tristan Keelan. My guests today have been Christa Foschio-Bebak, Director of Quality Improvement and Training at CCNY, and Catie Gavin, the First Deputy Commissioner of Erie County Department of Social Services. This has been another episode of the Data Doesn't Equal Outcomes podcast.